Hey folks, thank you so much for joining us for part 2 of this year's kitten shower. As you can see, we are not in the same place we were last time around. We are actually inside of our Mackey Center for Animal Care here in Detroit with one of our major hubs for kitten care sitting right behind us. Those cages up and down this entire side of the building are currently full of all sorts of felines, but especially some of our most vulnerable friends, who are what we're going to be talking about this evening. So I'm joined once again by Dr. Funky as well as Laura Niffen, and we are going to be chatting today about our tiniest of tiny friends. We have two of our bottle babies here with us today who are fortunate to have come into us with their mom. So mom is actually just hanging, getting a little bit of a break from the tiny kittens while they hang with us for today's presentation. But so many of these kittens who are this age, we're talking less than a week, are coming into us without a mom and in need of really critical support. And that support, while great here at the shelter, is actually best given in a foster home. So we want to talk today a little bit about how we provide care for our bottle babies, our nursing babies, as they get a little bit older. Last week we covered our older kittens, our graduate kittens. So this week's focus is going to be on the teeniest of teeny tinies. So if you didn't get a chance to watch last week's episode, please jump out of this one when we're finished. Don't go just yet, and check out last week's presentation about our older kittens. But today's is again going to be about our small friends. So while we're not joined by a foster today, we're hoping that somebody out there, maybe several somebodies, sees the presentation today and is inspired to maybe join us on the bottle baby journey. So without further ado, we are going to go ahead and jump into that presentation right now, and we will see you on the other side, where we'll get a chance to talk all things bottle baby and answer all of your questions.
I want to thank you so much for joining us for part 2 of our foster training series. I'm so excited to be here tonight to be talking to you about how to care for orphaned bottle kittens, as well as nursing mothers. I'm Dr. Clarissa Funky, and I am the Director of Veterinary Programs at Michigan Humane. So just to kind of review what we've covered in part 1, if you're more interested in taking care of some of our weaned age kittens, which are Gerber and graduate kittens, make sure that you go back and watch part 1 because we covered that there. We also covered an overview of our foster program. So just to quickly review, when you sign up to be a foster with us, we're responsible for the medical care of the kittens, the supplies, training, and all the support that you may need. As a foster, your responsibilities are going to be to provide them with a safe place to grow, make sure that you're being attentive to their needs, and be available for foster appointments. And I did want to mention that our shelters are located in the Detroit and Westland areas, and we do have some availability for medical appointments also in Rochester, although pickups and drop-offs would have to occur through our primary shelter locations. Also, I just want to take a quick moment to define the different ages of bottle kittens, Gerber kittens, and graduate kittens that we're talking about. So we use a developmental classification system at Michigan Humane. Bottle kittens are kittens that are going to be anywhere from 0 to 5 weeks of age. They're unable to eat solid foods on their own. They're going to need stimulation to be able to go to the restroom, and they need a heat source to be able to provide heat because they can't generate enough on their own. Gerber kittens are what we would consider our weaning age kittens or transitional. So those are kittens that may need some sort of assistance in eating solid foods, whether it's just having the food soften or having some hand feeding, but they're starting to move on to solid foods. They're starting to use the litter box, and they're starting to increase in mobility, and we see a lot of variation in this group. And then graduate kittens are going to be kittens that have completely weaned onto solid foods. They don't really need a lot of assistance at this point to eat. They're independent in most ways. They just need socialization, and they just need some time out of shelter until they're old enough to be able to be spayed and neutered and go up for adoption. So to go into a little bit more detail as to what's going to happen developmentally during the bottle kitten age, when kittens are born, their eyes and ears are closed. So they can't see, and they're not very good at hearing either. They're still going to have an umbilical cord attached. They're not going to be able to produce body heat on their own. They get that from snuggling with their mothers. And then at about a week old, we're going to see their eyes start to open, usually between 7 to 10 days. By 2 weeks, we're going to start to see their ears unfold. And then by 3 weeks, we're going to start to see them erupt their very first teeth. And then by 4 weeks, we're going to start to see them start to move around more and get ready to kind of move into that Gerber or graduate stage of development. So why does Michigan Humane have a foster program that focuses on kittens and especially bottle babies? Well, immediate placement of bottle-aged kittens in a shelter situation is really a life or death matter for them, and that's because they require feedings every 2 to 4 hours, including at night, and we don't have overnight staffing in the shelter, so our program relies on fosters to be able to take them and provide care in a way that we can't in the shelter. When you're signed up to be a foster with us, there's a couple different ways that we communicate our need for fosters. So ideally, especially for the bottle kittens, we like to use something called the foster on deck method. And that's where before the bottle kittens are even in the shelter, we would ask you to submit a survey regarding how many you're willing to take and what types of kittens that you're comfortable fostering. And then you would be added to a list so that we know who's ready to pick up kittens right away. So when kittens come in, we can refer to that list and call you and let you know, hey, your kittens are here, you can come and get them. And that really helps a lot because it minimizes the amount of time that we have to spend looking for foster parents who might be willing to take them so that we can get them out of the shelter the same day. Every year, inevitably, we run out of enough fosters to be able to place them all through this method. And so a lot of times we'll rely on temporary staff fosters to take them home overnight until we're able to find a better foster placement for them. If we don't have anybody on deck, they would get added to our daily email list that gets sent out to our larger foster group, not just the kitten foster parents. So you would be able to see them on there. And then a lot of times if it's urgent that we need to find a foster home for them and we don't have anybody on deck, when you sign up to foster with us, you can have access to our private Facebook group for foster parents, and we might put out like an urgent plea on there to see if anyone is willing to pick them up. So I really like fostering bottle kittens. This is my favorite age of kittens to foster. I think everybody has kind of a preference as to what their favorite age is, but I like them because they're very easily portable at this stage. They basically live in a carrier 24/7 because they're not really moving around a lot. They're very clean at this stage most of the time. So that's because they go to the bathroom, they eliminate on a tissue through stimulation. So there's no litter involved. You just throw the tissue away and they stay pretty clean and non-smelly at this point in their journey. I also just think it's very heartwarming and sweet to kind of raise them from this age. It just gives me butterflies in my tummy to be able to bottle feed them. The cons, which there definitely are cons to bottle kittens, are that you do have to typically wake up at least once in the night to provide them with a nighttime feeding, and that really depends on the age of the kitten. Bottle kittens, because they're so small and so fragile, can develop more health problems, and that can mean that you need to go into the veterinarian more frequently, which we do provide all of the care through our clinics and our shelters. So at least veterinary care is easily accessible, but you may need to be more available to come in for veterinary checks if they're not doing well. And again, because they are so fragile, unfortunately, they do have a higher mortality rate than the older age kittens. So I do have to always like emotionally protect myself a little bit and be prepared for the fact that occasionally we can sometimes lose one of these. Okay, so to go in a little bit more detail about the care that's involved with bottle kittens, every time that you're caring for your kittens, every few hours, there's going to be a certain amount of steps that you go through each time. And then in between that, you just put them back in their carrier and they go to sleep. So when you take them out, you're going to want to weigh them. You're going to want to help them go potty by stimulating them with a tissue. You're going to bottle feed them. You're going to make sure that their heat source is still warm in their carrier before you put them back. And then we want to make sure that we're always recording everything in some sort of record keeping notebook because it can help you notice small changes in weights and when they went to the restroom the last time, especially when you're doing this multiple times a day with multiple kittens. It can be really easy to kind of lose track of who's doing what. To talk a little bit about feeding, there's a lot of things to remember. This is kind of the bulk of the presentation because there's a lot to feeding kittens. The first is there's two different formulas that we use for kitten milk replacer. So that would be the KMR brand or Pet Egg. And the other one is Breeder's Edge Foster Care. Both of these are really good options, and we can provide both of these in the supplies that you would pick up along with the kitten. It's going to be important that you look at the label instructions for both of these because each of them is a little bit different. Both of them are shelf stable before they've been opened, but KMR, once it has been opened, needs to be stored in the fridge, even in the powdered version. And it's only good for 3 months once it's open, so you want to make sure that you date that every time and then keep it in the fridge after it's been open, whereas Breeder Edge remains shelf stable even after opening. In terms of like the gear that you would be using for bottle kittens, the typical bottle kits that you would find available in most pet stores are going to be like the one that you see in the picture here. We do have alternative nipple attachments that we recommend called Miracle Nipples, and I'll show you an example of that on the next page and talk a little bit about why we prefer that one. In the beginning, when we're first starting off new bottle kittens, we do prefer to take the nipple attachment and attach it to a syringe because it's going to give you a little bit more control as to how quickly they consume the milk, and it's going to allow you to measure the amount of milk consumed easier than you will with the bottle markers that are a little harder to read, especially when you're talking about really small amounts. As your kittens become better at bottle feeding and they learn how to latch efficiently, a lot of fosters will switch over to the bottles because it does contain a lot more milk, and if you're feeding multiple kittens, you can feed all the kittens typically off of the same bottle, whereas you would have to pull up an individual syringe for each kitten if you were feeding out of the syringes. So it does make it a little faster after you've established a good latch. In terms of preparing the formula, the dilution ratios of the formulas are going to be on the instructions on the back. Sometimes we will dilute it further, especially if the kitten is having constipation issues, but we typically wouldn't go past like a 1:3 or 1:4 dilution. And typically we can advise you on that if you're struggling with those things. Temperature, we want it to be warm but not too hot so that they're not going to burn themselves on it. There's a couple different ways that when you're mixing your formula up that you can ensure that you're getting the right temperature. So you can use hot water the first time, but a lot of times we like to mix up like a 24-hour supply of formula and store it in the fridge so that you don't have to mix it from scratch every time. When you're doing that, you're going to need to heat it back up. The quick option that's a little less safe is to put it in the microwave. You can microwave the bottle or the formula and then put it into the bottle. But if you do that, it's typically somewhere between 5 to 12 seconds that it needs to be warmed up, and anything longer than that, and it's going to be way too hot. When you heat in a microwave, it can also develop localized like hot spots where it's significantly hotter. So we want to make sure that we're mixing it and swirling it and then checking it on our wrist to make sure that it's a comfortable temperature before we're feeding the kitten. If you have more time or if you're feeding multiple kittens, this method that I'm showing in the picture also works really well. So you can take the cold milk in the bottle or the syringe and then fill up a coffee mug with hot water and let it float in there, kind of swirling it every couple minutes, and it will warm up within a few minutes that way. It does take a little bit longer than the microwave, which is a con, and when you're waking up in the middle of the night for the nighttime feeding, but you're much less likely to get it to a temperature that's potential to burn the kittens. It's also nice when you have multiple kittens because you can put it back in the coffee mug to float while you are going through the rest of your care routine with them so that it doesn't get too cold before you move to the next kitten. So I use a combination of these methods, but I do always make sure, like from a paranoid perspective, that I'm checking it on my wrist multiple times to make sure that it's the right temperature. Here are some of the different options that I was talking about. So these are the Pet Egg nursing kits on the left, and you can see it comes with a variety of different nipple attachments. I have found that the only one that really works well for kittens is the one that is very long and skinny and looks more similar to the Miracle Nipple ones on the right. Kittens can sometimes be picky about the texture and shape of their nipple attachments. So that's something to consider, because if the Miracle Nipple wasn't working for you, you could try this one. It's a little bit softer. One of the big downsides to the pet ag nursing kits is they don't have holes cut into the tip of the nipple ahead of time, so you have to manually cut it. If you cut it too big, then the flow of milk will be too fast, and if you cut it too small, the kitten can get frustrated from having to work too hard to pull the milk. So sometimes if you mess up cutting it, you need an extra nipple attachment, so that can be difficult sometimes. So that's why the majority of the time we do prefer the Miracle Nipples. They're also nice because the Miracle Nipples are the ones that fit nicely on the tip of a syringe, but can also be adapted to the pet ag nursing bottle kits. So they'll fit in either of those devices, which is nice. And then they do make a miniature version for very small kittens, although my experience has been that like really the mini size only works for about the first week or so, and then their mouths are a little bit too big to get a good latch off of the mini after that. In terms of the actual technique when you're feeding kittens, one thing that is really important is to make sure that you have appropriate positioning when you're feeding the kitten. So never try and hold the kitten like you would a human baby. So they always have to be belly down against the ground. So if you ever watched a mother cat nursing a kitten, you would see that they never lay in upside down positions. That does make them more prone to aspiration pneumonia, where they could inhale milk into their lungs instead of down their esophagus and into their tummies. So always belly down. That's, if there's only one thing that you take away from this lecture, it's that. Feed them belly down. A lot of times we'll need to assist them with their head. A lot of the kittens that are just learning to latch, or a lot of the kittens that are so excited to nurse that they're kind of like wild and out of control, can just need kind of finger placement on either side of the head, right below the eyes where the cheekbones would be, to just kind of keep them in the right position to be able to stay on the nipple and not pull off. And then sometimes when you have a really overzealous nurser, it may help to kind of take a burrito wrap or like a towel and wrap them up so just their head is exposed, because sometimes they will try and like claw the bottle out of your hands. They're so excited. So to get a little bit more control of the situation so that they don't put themselves in an abnormal position, you can towel wrap them if you have one of those. If you do have a kitten that's that overzealous about feedings all the time, it may be that you're spacing your feedings out a little bit too much and they're getting to the point where they're starving. So you may want to decrease the time between feedings if you have a kitten that's consistently behaving that way. The other thing that we're going to want to watch for is a proper latch. So that is an indication that the kitten has appropriately attached to the nipple attachment and has opened their esophagus in a way that they can efficiently swallow milk without choking on it. Some signs that you have a good latch are that they have something called taco tongue. So they'll be thrusting their tongue against the nipple, and as they do that, they'll have their tongue kind of wrapped around the nipple in a U shape, kind of looks like a taco shell, so that's why we call it taco tongue. You'll also see ears and whiskers flicking with each suck that they take of the milk. And if you are feeding from a syringe, you should see signs of negative pressure if they're actually taking the milk in. So we don't actually apply a lot of pressure with our fingers to the stopper. The kitten will move the stopper for the syringe by itself for the most part, and we just apply just enough pressure to keep it from sticking, because that can make the kitten frustrated if they're sucking really hard and it doesn't move at all. And I'm going to show you a video of this in just a second so you see what I'm talking about. Okay, so here we have a kitten that's got a very good latch. You can see how quickly he sucks that down. You can also see the flicks, and he's one of the ones that I'm talking about where he's showing signs where he's a little overzealous. And you can see him kind of grabbing with those fingers and trying to creep forward. So Although we don't have the hands on the head in this video, you can see she's got a hand on the kitten to kind of try and keep him in the right position so that he doesn't go crazy. One more time, and you can see how he's moving that syringe plunger. Okay, so when kittens come to us as new orphans, a lot of times they haven't ever been bottle fed before, and they don't understand how to latch on something that's not their mother's. And this can be a skill that takes 24 to 72 hours to learn. My experience is that kittens that are new newborns or less than a week old typically have an easier time learning to latch than older kittens, like the 2 to 3 week old ones, because those ones have had more time with the mother and the nipple and the artificial nursing feels different to them. But we try to be patient to that time. It can be anxious because you want to see your kittens start to gain weight right away. But I don't really stress too much about this because at one point, as you're working on getting them to learn this, a little light bulb sort of goes off in their head and all of a sudden it just kicks in. What we want to do is make sure that when we are syringe feeding them during this time, that we're going slow enough that we don't cause them to aspirate. And I'm going to show you a picture of what it can look like in a minute when we're just teaching a kitten to latch that doesn't know how. So aspiration, as we talked about, is inhaling milk into the respiratory tract. We prevent it with proper positioning and allowing the kittens to self-regulate consumption. So those are the two biggest things that I'll sometimes see go wrong. We already touched on proper positioning quite a bit, but we allow the kittens to decide when they want to pull off the nipple when they are done feeding. If you're worried that they're not consuming enough, the solution is not to try and force them to consume more, because that's when they would typically like try and close their mouth to prevent them from eating more. They decide when they're full. So we want to make sure that we're not giving them aspiration pneumonia. Typical signs that they're starting to have that problem might be like during the feeding, they start sneezing and milk is coming out the nose, or they pull off the nipple and their mouth breathing. I haven't seen this many times in my time managing this foster program. Out of thousands and thousands of kittens, I think I've only seen kittens aspirate twice. But I would say the ones that do are typically either going to be kittens that are just learning how to nurse, or those really overzealous kittens that are just so wild. So that's why we want you to do those preventative measures, like making sure that you're guiding their head, holding their body in place, and wrapping them in a towel if you need to. If you do think that you've had a kitten that is aspirated, you can call our foster hotline and we will get you right in for a medical appointment so the vet can examine them. A lot of times before they move to full aspiration, you might just see the sneezing the milk out of the nose thing. If you're concerned that the latch doesn't look normal or you're seeing symptoms like that, stop the feeding for a minute and just pause and watch how they're breathing. And if they look fine otherwise, there's no signs that they're having trouble breathing, you can try again. But if it happens again, give us a call so that we can kind of help you through things and troubleshoot before it gets worse. Okay. So here we have a video of a kitten that is just learning how to latch, and you can see how differently this one is going from the video that we watched previously. What is important to do is to just put the tip of the nipple in the mouth, but like not all the way in like a kitten would. The kitten has to latch and pull that rest of that nipple into the mouth on its own. And then we're just going to drizzle like the smallest amount of milk onto the tongue so that they can taste it. What we don't want to do is like flood the mouth with formula, because when that happens, that's when they might choke on it. So we're just trying to like get them enticed to eat by the flavor of the milk. And if we only get a couple mLs in for the whole feeding and it's the first couple days, we don't stress too much about it. That's as much as we can do. And eventually they just sort of figure it out. And I can't explain why or how, but a little light bulb goes off and they just figure out how to do it at one point. Okay. So to move on from talking about feeding now, let's talk about the other parts of the care routine. So in terms of getting them to go to the bathroom, I've heard different people advocate for different things. My preference is to use like a soft form of like nose tissue. Some people like to use cotton balls, toilet paper, gauze pads. I've heard some people like to wet like a washcloth or something like that. I typically prefer whatever I'm using to stimulate them to be dry because it allows me to see the color of the urine and how dilute it is, which is one of the indicators of health that we're going to talk about. Basically, you're going to gently rub the genitals of the kitten, and you almost have to barely touch them to get the kittens to urinate most of the time. That's the easy part. The harder part is getting them to poop. So when I'm done getting them to urinate, which they will do typically every time that you do this, I'll kind of stroke backwards and like across the anus and push the tail up as I'm doing it. And maybe about once a day to once every 2 days, you might get them to poop, but not every time like you would for urination. So as I mentioned, urine color matters. It should be straw colored to clear colored. So anything that's darker yellow may indicate dehydration, and that's because really young kittens lack the ability to concentrate their urine in their kidneys yet. So if it looks like darker colored urine, that may be a sign that you need to either dilute your formula out more, increase your feedings, or potentially even add Pedialyte instead of water to your formula because your kitten might be getting a little dehydrated. As I mentioned, in terms of stool, you're going to see it every 1 to 2 days would be normal. Kitten stool, sometimes people expect it to be firmer than it actually is. An ideal kitten poop would be either soft serve to Play-Doh consistency, and this is really important to understand, even though it might seem a little weird that we're talking about kitten poop, because that's a really good indication of the kitten's health. Kittens struggle a lot with both diarrhea and constipation, so we're looking for soft serve to Play-Doh consistency. So anything firmer than that, I would consider constipation. And it's really common in formula-fed kittens, and that's because it's just not possible for commercially made kitten formulas to have as much fat in them as mother's milk would, so they tend to cause a lot of constipation. So if your kitten has gone more than 3 days without defecating, at that point they may require a warm water enema, which if you bring them in for an appointment, we can do. We can also sometimes teach you how to do it if they are going to need to be repeated at home. The long-term solution for this, and a lot of the times with my fosters, I just do this from the beginning at this point, is fiber supplementation and formula dilution. So in terms of fiber supplementation, I will add like the smallest amount humanly possible of like a Metamucil type like psyllium fiber, or the tiniest amount of canned pumpkin to the formula when I'm making it, and that seems to resolve a lot of the issues. And then a lot of times I will dilute the formula out a little bit more than the label instructions recommend, to just add a little bit of extra water to it to hopefully help it soften up enough to pass through. So just to show you what this looks like in real life, here's a video of someone stimulating a kitten to go to the restroom. And you can see that it's a pretty straightforward process. You just kind of gently bump the genitals with the cloth, and that's all there is to it. One thing that I don't think I included in the last slide, but I do think is important to mention, is going to be that after you're done with this, I see less issues with rashes and urine scald if you do go back with a wet wipe after, and just wipe down that area so that you don't get any residual urine on the belly or from the rag when you're wiping it. And that can help a lot in preventing them from getting urine scald, or if you have a kitten that has diarrhea, getting diarrhea scald. So just remember to clean them up after. Okay. In terms of the other parts, talking about monitoring weight, so this is going to be very, very important to making sure that you're identifying health problems early in these young kittens, because oftentimes when they're not showing any other signs in illness, the first thing that we'll see is they drop off in terms of their weight gain. So ideally, kittens should be gaining about 10 to 15 grams a day, but that's an average. So sometimes one day it can be 7 to 8 grams, and then the next day they play catch up by gaining 20 grams. When I really get concerned is when they're only gaining like a gram or two per day, so they've like plateaued completely over several days, or anytime that there's weight loss. Now, to interpret weights correctly, you want to make sure that you're weighing them at the same time in your care routine every time, so that the weight doesn't change with the feeding. So if you weighed before a feeding one time and then the next time you weighed after the feeding, the weight of the milk in the belly is also going to be added to that. So we just want to make sure that it's like after feeding every time or before feeding every time. And same thing with stimulating them to go to the bathroom. Just keep it consistent, because even just the urine that they expel every time when you stimulate them to go to the restroom is going to change their weight by a couple of grams, which may mess with your interpretation of what is actually weight gain. When I'm taking care of my own kittens at home, I tend to weigh them before and after every feeding, because it gives me an idea of how much weight they're gaining between each feeding. But I might not record all of those. I might only record the after feeding one. And ideally, I would record this at least once a day, but you can do it at every feeding. More is always better when it comes to kittens in terms of paying attention to the details. So here we have a little chart, and we do have these available in like a PDF kitten care guide version that we can give to you as a new foster, but it just gives them an ideal range of where they should be falling in terms of weight, the amount of milk that they should be consuming, and the frequency of feedings that you're going to see. So there's definitely a big difference between taking a 1-week-old kitten, which has to be fed every 2 hours, which means typically that you're waking up multiple times during the night, whereas a 3-week-old kitten is far less of a commitment, because you're probably only going to have to wake up once at night, since it's every 3 to 4 hours. And a 1-week-old kitten is also going to be, the wake-ups are going to have to be for a longer period of time, about a month, until they get to the point where they're weaning. Whereas a 2 to 3-week-old kitten, again, in terms of commitment to having to wake up in the middle of the night, much shorter period, because in a week or two, they're going to wean. So that's something to consider when you're filling out your foster survey for the on-deck stuff, because if you're sort of like not sure that you're ready to commit to a month of waking up in the middle of the night multiple times a night, we still need a lot of fosters for those slightly older kittens. So both are helpful, okay? In terms of housing, one of the things that's really great about bottle kittens is they have very small space requirements. So for those first 3 weeks, especially, they're not really moving around a lot. They can basically live in a carrier. If you have a situation where you can bring them to work with you, they can live in the carrier at work. They're typically pretty quiet compared to the older age kittens, and they really only cry if they're hungry for food when it's time to eat. We do want to make sure that we include a heat source in the carrier. So this can be something like a Snuggle Safe, which is a heating disc that you can heat up in the microwave. It'll hold heat for 8 to 12 hours. We always run out of these. We never have enough of them. So we can also use fluid bags. We dye them so that people know that they're not to be used for administration of like fluids into the body at that point. But those can be microwaved, and they will hold heat for about 4 hours at a time, which is the average time that you would be going between feedings. You just have to reheat them every time before you put your kitten back. We like to provide a lot of blankets, especially over the heat source, so that it doesn't get too hot for them, and provide space in the carrier where they can move away if they're getting too warm. We like to use fleece blankets over anything like a terry cloth or a towel that would be looped, because kittens don't have the ability to retract their claws when they're that young. So they can get snagged in the loops and get tangled up, and bad things can happen when we use towels. So we prefer those fleece blankets. In terms of record keeping, we want to make sure that we're keeping track of the record of the volume consumed, the weights of the kittens, and what they did in terms of going to the restroom. So at minimum, we want to record daily what's happening, but it's better if we can do it at every feeding, especially when you have multiple kittens. It's just really hard to keep track of what everybody's doing. And we know from actual studies of other foster programs that better record keeping is associated with improved survival, which I think is a really cool thing. Just the act of paying that close of attention really can help alert you to when they're developing a health problem before where we can intervene before it gets too out of control. So a lot of them will just live in these open top carriers, and we can provide you with those. This is a picture of what those Snuggle Safe heat discs look like. They do have a fleece covering for them, but we do recommend putting 1 to 2 extra layers of blanketing over them because they can get quite hot. When you're ready to transition your kittens, you will notice for litter box training that around 3 weeks, you might start to notice like an odd smell in your carrier. Remember, their urine is still very dilute at this point, so it doesn't smell strongly like normal urine would, but you might notice some damp spots and like an odd smell coming from your carrier. That's probably a sign that they've started to urinate without stimulation. So at that point, you're ready to upgrade them to a slightly larger enclosure. Typically, I see a lot of people using like those plastic storage bins, or we have guinea pig or rabbit cages that are available on the next page, which are sort of give you enough space to include a litter box in their housing situation, but not so big of a space that they can not find their litter box. And at this point, they're still not typically eating solid foods. So you don't need enough space to like include solid foods at that point. In terms of the types of litter that we have available, unfortunately, the litter that we loved the most is no longer in production, and that was the Yesterday's News litter that was pelleted newspaper. There are some brands that still make it. It's part of our kitten registry items. We prefer it to the kind of litter that's shown here, which would be the clay litter. The kittens that are really young sometimes can get this stuck in their feet. So if this is all that is available for your kittens, we just make sure that you are cleaning out the feet so that they don't get any little rocks or anything stuck in between their little toesies. But as we have it available, we will still provide some of the pelleted litter just because it's a little bit nicer for this age of kitten. And then we start them out with these paper plates because it's really easy for the kittens to find this. They don't have any big ledges to get over, and then gradually increase the size of the litter plan. All you have to really do is put them in this sort of regularly so that they can feel the texture of the litter under their feet. For most kittens, it's pretty instinctual to use a litter pan to go to the restroom on their own. And if they do have accidents, especially poop outside the litter box, rather than just cleaning up the poop, putting the poop in the litter so that they know that that's where the poop goes can be helpful. We also, for kittens that are not great about using the litter box, have a product called Litter Attract for kittens that has pheromones in that encourage them to use the litter. So here's a picture of the setup that I was talking about. We like the ferret litter pans because they have the low edges and they're a little bit smaller for kittens that don't really need a big litter pan yet. This just gives them a little bit more space to start stretching their legs and moving around, but isn't so large that they're going to be overwhelmed and not be able to find their litter box when they need to use it. In terms of weaning them onto solid foods, this can happen anywhere between 4 to 6 weeks of age. I will say the older the better in terms of weaning. So the younger that a kitten is when it weans, the more likely they are to develop GI problems and diarrhea problems. Kittens' GI tracts are most prepared to handle solid foods at around 6 weeks. Unfortunately, that doesn't always work out, and the kittens sort of decide when they're ready to wean. because a lot of times when they develop those premolar back teeth, and those start erupting, they may start chewing on the nipples, and then we sort of have to transition them over because they are at risk of chewing the nipple off and swallowing it, which could become a dire situation. If you can get your kitten to the older side before you wean them, if they are willing to continue to bottle feed closer to 6 weeks, a lot of times they can go straight onto wet solid food instead of having to do like a gruel mixture or something like that. And they are much less likely to have diarrhea problems again if you can get them to do this, but it doesn't often work out this way. So in terms of weaning, there are a lot of different ways that people will do this. A lot of the times you can just put out a gruel bowl like we see here that this kitten likes to walk in, which they all do, and then just sort of hand feed them, put a little bit in their mouth, and then gently over a couple feedings guide them to the bowl, and eventually they figure it out. Some other things that I've seen work are if you are watching any of the Kitten Lady videos, she often weans with something called a meat bottle. So she makes a super liquidy gruel. She chops the tip of her bottle off to be a lot bigger so that chunks can fit through it and like not get stuck. And she will actually like bottle feed them a very liquidy gruel solution. You can do a little bit of just syringe feeding without the bottle tip, so you can really puree it down in a blender or something so that there's no chunks in it, and just squirt small amounts of it in their mouth if they're having a hard time figuring it out. And I've even seen some kittens do something where they'll only want to eat cereal. So you literally make like a bowl of kitten milk replacer and then you float like a solid hard food in it. And the thing about kittens is a lot of times you can do it the way you want to, but they're not necessarily going to respond to that. Each one is sort of different and you sort of have to figure them out. So I'm just trying to present you with some different methods so that you have different tools in your arsenal if the kittens aren't responding in the way that you would like them to, by introducing a gruel bowl or syringe feeding them, so that you have some different unique options to provide. And here's some setups that once you transition them onto solids that work a little bit better to provide them with a little more space. There are a lot of different options that we have available. We do have some of these modular units that you can use. We have pop-up playpens, and if you go back to part 1 and you watch, we talk a lot more about different housing setups that you would want for these older age kittens. Finally, moving on to talk about nursing mothers. If you like the idea of having the really young bottle kittens, but you're feeling a little bit intimidated about the amount of care that they require, fostering a nursing mother with kittens might be a good option for you, because they do have all the cuteness of bottle kittens, but most of the time they are less work because the mother is doing it most of it for you. Now, I say most of the time because occasionally we may have a mother who is struggling with her own health problems. Sometimes the moms don't come in really great condition, or they develop an upper respiratory infection, may not be eating and drinking as much as normal, or you may have an individual kitten in the litter that struggles more and they may need help with assisted feedings. And if that does happen to you, there are options to return them to the shelter if you don't feel comfortable doing that, or we can teach you how to do that in person with like a guided session. It's still typically not as much care as would be required for a bottle kitten, because a lot of times it's just a few days that the mom needs to be able to increase her milk supply, or to just kind of get the one kitten through their health issue and back on the right track. So we just provide them with a couple supplemental feedings here and there. And a lot of times she's doing the rest of the work. She's still providing the heat source. She's still stimulating them to go to the restroom and keeping them clean and doing all those things that you would have to do if they were an orphan. We still do want to make sure when we have a nursing mom that we're weighing the kittens daily, so we notice if any of them is starting to struggle. And because you have an adult cat with you, it is going to require a larger space than it would for bottle kittens. So here you can see it's more of like a room space type setup. You could use a bathroom, spare bedroom, laundry room, mud room. If the floors are a solid surface, that's always easier from a cleaning perspective and disinfection if you're going to foster another litter with us after you're done with this one. So you will need a little bit more space for these. In terms of the mom, we want to make sure that we're monitoring her stress level. A lot of the moms, we want to see them, grooming their kittens, purring. They should look happy. If they do appear stressed, we want to make sure that we're giving them enough space, that they have space to get away from their kittens, that they have space to get away from us. And a lot of times just a quiet room with minimal intervention until the kittens get a little bit older can help a lot with that. Want to keep an eye on her appetite. The mom's appetite is going to be directly correlated with how much milk she's producing for her kittens. A lot of times we will provide them with kitten food because it's higher in calories than adult foods because she's burning so many calories from breastfeeding her kittens. We also want to make sure that we're just kind of checking out her belly area if she will allow us to monitor for signs of mastitis. Mastitis is an infection of the breast tissue when they're lactating. You would see discoloration, redness, heat, swelling of the affected mammary glands. And a lot of times these cats really don't feel good, so you'll frequently notice that they'll stop eating or be really dumpy when they're developing this. More often than not, if we're going to see mastitis, which isn't a common problem, but it can happen, is going to be after the weaning time when they get engorged and their milk glands are no longer being emptied by the kittens. So we do always want to monitor them, especially during that end stage weaning period. So when you have a mom with kittens, if they don't have to necessarily be taken off the mom at the time that they would be Gerber kittens, it's actually better for them because a lot of times they'll just wean directly onto solid foods because they can watch their mothers eat and then still nurse on her while they're figuring out how to eat solid foods. That's ideal. So we keep them with her. If everything's going well, she appears unstressed and happy until about 8 weeks of age. Now, at that point, the kittens can return to the shelter to be spayed and neutered and go up for adoption. But if you are willing to, moms typically need to wait 1 to 2 weeks after the weaning process to be able to be spayed. And during that time, if you don't want her to have to sit in the shelter, she can go back to you. And that's just to let her dry up and let her mammary glands shrink down so that she doesn't have any complications during surgery. So thank you so much for tuning in tonight. I really do hope that you consider signing up to be a foster with us because we do really rely on you in the shelter to be able to help save this age of kitten. We wouldn't be able to do it without you. So for more information, if you're more interested in older kittens or you just want to know more about our foster program in general, please go back and watch part 1. And if you're ready to sign up to be a foster, you can go to www.michiganhumane.org/foster. Thank you.
Hey folks, welcome back. Thank you so much for joining us again here for Kitten Shower Part 2, where we have been discussing bottle babies. So you just heard a wonderful presentation from Dr. Funky about all of the things that are involved with caring for bottle babies. And we know it sounds a little daunting, so we're actually going to kick off tonight's Q&A with that question. Is this hard? Is it difficult? We get that question a lot. So I'm actually going to turn to these lovely ladies and have them answer it. Laura from a foster perspective and Dr. Funky from the medical perspective. Is it difficult to care for bottle babies?
So if you're brand new to it, I think there can be a little bit of a learning curve. But once you get into the swing of things and get into a routine with the kittens, it's pretty easy. If you don't mind waking up in the middle of the night for a couple of weeks.
Dr. Funky.
Yeah, I mean, I've certainly fostered a lot of these little guys, and you do fall into a routine that makes it easier, especially after the first couple nights. They get used to eating, you get used to how to streamline your efficiency of feeding them, and time when you wake up so that you have to do it as minimal amount as possible. I mean, from an emotional perspective, it's one of the most rewarding things that you can do, but that can also sometimes be hard too, right? It's like raising a child. It's an emotional experience.
It for sure is. So piggybacking that, We also get a lot of questions that are related to time of commitment, right? So we know that we've talked about 8 weeks, 2 pounds. That's the point in which they can go find that forever family. 8 weeks is a really long time. It is a long time. So Laura, if somebody is interested in fostering, knows that they can't necessarily commit to the full 8 weeks or even sometimes 10 weeks, depending on where our milestones are with our kittens, can they still foster for us?
Absolutely. So you can foster any of the age groups. With the bottle babies, if you're open to fostering them, these little guys, they cannot stay overnight at our shelter because we don't have overnight staff here. So if you are able to take these little guys for a couple weeks and get them to the point where they are eating on their own, and we can, find another foster for them or bring them back here until we do, because they can stay at that point, that is a huge help, and it literally saves their lives.
For sure. So we've done the foster. They have bottle fed. They are now weaned. They have hit all of their milestones. They're ready to find a home. Do we get to keep the kittens? Do I get to pick who takes the kittens home? How does that part work?
Well, so if you fall in love with your foster kittens, you absolutely can adopt. If you have friends or family members that are interested, we can put adoption holds on them for those friends or family members. As a foster volunteer with us, or a volunteer in general, you do get an adoption discount once per year as well that can be used for yourself. You're not able to pass that along to friends or family members. But if you do fall in love with one or two or three, you can adopt them.
All right, folks, so thank you again for joining us. So we do just want to send out a little reminder, maybe a little bit of a nudge. If you're not in a position to foster right now, that's okay. The fact that you're tuning in to support our Kitten Project is really an amazing, amazing thing and an amazing gift to all of us. What else would be an amazing gift is if you were able to send us an item from our registry. So we have accessible items on both Amazon and on Chewy. If you want to send something to help support our teeniest of tiniest felines, to help make sure that they're able to thrive in those foster homes and get everything that they need. So if you want to send some well wishes along with a care package to the kittens, we would love to receive that. Again, those Amazon and Chewy wish lists are accessible. You can check them out on our website and check into all of the options for gifting from there. You're also welcome to drop things directly at the shelter. We love it when folks come and visit and want to say hi and connect with us and connect to the mission. So thank you all again for tuning in. If you think of any follow-up questions, if you want more information about fostering, if you want more information about kitten care in general, please reach out to us. You can connect with us for fostering at michiganhumane.org/foster, and you can also direct any general inquiries through our Contact Us form on the website as well. Thank you so much again for tuning in, and hopefully we will see you with a basket of kittens sometime in the near future for one of our foster appointments. Thanks again, folks.